Trigeminal neuralgia. It's maybe something you haven't heard of before, but it is a chronic facial pain condition, and it can be really debilitating. Dr. Paiman Ghafouri, a board-certified radiation oncologist with Austin Cyberknife, and Dr. Ramsey Ashur, a board-certified neurosurgeon at Ascension Seton Brain and Spine, are both here with us this morning to talk about symptoms and treatments. Good morning to you both, gentlemen.
Morning.
Morning.
Thank you for being here. Let's talk about this because I actually know somebody who's had this before, but I didn't know the term. Tell me about what trigeminal neuralgia is.
So trigeminal neuralgia is a facial pain syndrome. The trigeminal nerve comes off of the brainstem and controls the sensation of the face. So neuralgia is nerve pain. So trigeminal neuralgia, when you put that together, it's a syndrome of pain in the face. It's very excruciating pain. It's been described as the worst pain in the history of humanity for some people. People have committed suicide about it. So it's a very severe pain syndrome.
Yeah, I know that you have said that it is something that can be so debilitating. So let's talk about the signs and symptoms for maybe somebody who doesn't realize that this is what they're dealing with.
Sure. So it's usually pain on one side of the face. It can be nerve-like pain. So it's electrical, stabbing, shocking pain. It can be triggered by things like brushing your teeth, even just touching the face, eating, drinking, wind on the face. And it's just very severe and debilitating, and it really paralyzes people and prevents them from being able to do just the very basics.
Yeah, I mean, I'm thinking that's just how you get ready in the morning, right? To eat something, drink something, brush your teeth, walk outside and feel the wind on your face. So I can't imagine how painful that might be. So let's talk about, how when you guys first prescribe medicine, if that doesn't work, you start to move on to true bigger treatment options. So you've got surgical treatment options. Tell me a little bit about that.
Sure. So the main cause of it is a blood vessel pulsating on the nerve and irritating the nerve. So it's a very straightforward surgery. We make a small incision and a small quarter-size opening in the bone behind the ear, and then we can go down under a microscope and dissect that blood vessel and basically just move it off of the nerve. And oftentimes we put a little sponge there to kind of keep the blood vessel off of the nerve, and then the problem is usually fixed. So it's a very straightforward, definitive operation to treat it.
Oh, that's wonderful, and I know that that's one route that you can go. Sure. But Dr. Ghafouri, you're kind of here as the Cyberknife expert. So tell me a little bit about how Cyberknife works and how it can be used to help trigeminal neuralgia.
Well, Cyberknife treats the same condition, trigeminal neuralgia, because it's considered a progressive disorder. So when medicines don't work, it usually gets worse over time, and sometimes the medicines become, or the pain becomes resistant to the medicines. And so we look at these different treatment options. And Cyberknife is used to treat the actual nerve with pinpoint high-dose radiation. It's very focused radiation on the nerve itself. It's a non-invasive technique, and it also has a chance to relieve the pain.
Mm-hmm. And talk to me, the both of you, because I know both of you have seen patients who have been dealing with this. When you have cured them, when you've helped with the pain, what are the sort of reactions that you get? Dr. Ghafouri, I'll start with you. When patients come back and say, you know what, I feel that the pain has been released.
Well, we've treated trigeminal neuralgia for many years at Austin Cyberknife in many patients, and many of them have had their pain permanently relieved, and it can be, or I should say it is usually a life-changing event.
Wow.
These patients are typically in tears. They have regained quality of life. They can resume lots of activities that they totally abandoned, social activities. Some patients can't even eat properly. So it is a huge impact. It's a life-changing event, and it really improves quality of life.
I love that. Okay, and Dr. Ashur, to you?
No, I totally agree. As a neurosurgeon, it's one of the most rewarding conditions that I treat, because it's a life-changing success when we're able to take away this facial pain. And yes, I think when patients talk to us about it, they can't even hold back the tears. When they talk about the pain they once had, they almost don't want to jinx it. Because it's just been dominating their life for so long. Many patients have had, dental procedures thinking it was a dental condition and have been sort of going through it for a couple years. So that's kind of why we're here, is we want to raise awareness that this is something that we can impact and really can treat very effectively. But the first step is just knowing that you have it.
Sure, and we appreciate you both for not only being here to raise awareness, but thank you both for treating people as you do. We appreciate your time this morning.
Thank you.
Thank you.
Austin Cyberknife is located on I-35 near the Del Seton Medical Center at the University of Texas. Call them 512-324-8060 or go to austincyberknife.com for more details.